Good day, I am Dr. Krishamo Orpia, and I will be part of Group 2 to discuss chronic kidney disease and whole food plant based diet. This presentation will compose of the following: a case discussion, management of the case, and discussion of CKD nutrition diet in a Philippine setting. For an overview, this is the case vignette. This is the case of FTD, 56-year-old male, married Roman Catholic, residing at Carigsur, Tuguegarao City. He is for his regular follow-up in our primary care clinic. The patient is a known case of chronic kidney disease secondary to hypertensive nephropathy, hypertension grade 2, control. Patient has no subjective complaints during the first consultation. Again, he was diagnosed with hypertension since 2018. Medication review noted that he is on amlodipine 10 milligram tablet once a day. He is also diagnosed to have chronic kidney disease since 2020. Currently, no other comorbids other than the two were mentioned in his history. No other blood diseases and no history of cancer. For the family history, the patient has a strong paternal and maternal history of hypertension. No family history of diabetes, no family history of cardiac disease, no family history of TB exposure, bronchial asthma, or any hereditary illness. He is currently the financial provider of his family and a father of two children. His two children is 18 years old and 10 years old. They, along with his wife, are on a nuclear family with adolescent stage in the life cycle. For the personal social history, the patient is a non-smoker. However, he is fond of alcohol beverage drinks, consuming 3 bottles of beer per session with amounting of 3 sessions a week. He is a farmer and an elementary graduate. On physical examination, we move to the lifestyle vital signs. The weight of the patient is 76 kilograms. The height is 160 centimeters with a BMI of 29.6, categorized as obese 1. Blood pressure is 130/80 millimeters mercury on both left and right arm, heart rate of 84, respiratory rate of 18, and oxygen saturation of 98% at room air. For the physical activities of our patient is currently noted to have no exercise routine. Nutrition: 1 serving of fruit and vegetable a day, amounting to 3 to 4 cups of rice a day, 4 to 5 glasses of water a day. Drinks carbonated drinks daily, and eats fried food and processed food daily. Lifestyle vital signs noted that patient is often stressed out due to his condition and unable to work during times of stress. Patient is noted to be asleep around 9 p.m. and wakes up around 5 a.m., amounting to 8 hours of sleep. Emotional wellness: trying to make ends meet with their family from day to day, and noted that the problems at home would even step out with the affordance of his medication. Tobacco use: has no problem with tobacco. For alcohol, Audit C was done on assessment, noted to be 4, but still at risk of developing alcohol misuse. He noted that it's his own coping mechanism for stress. On physical examination, the patient was unremarkable. GCS 15, fair skin, good trigger, no cyanosis mentioned. No neck vein distension, no retractions with clear breath sounds, adynamic precordium with normal rate and regular rhythm, no murmurs, non-distended abdomen, no ascites, soft, normal active bowel sounds, non-tender. The extremities showed no edema with a normal neurologic examination. Laboratories during the follow-up were as follows. For urinalysis, noted to be yellow hazy, negative for glucose on urine, +1 on protein. WBC is unremarkable, RBC as well, with few amorphous urates. Blood chemistry was also requested for the follow-up. normal FBS levels of 81. Creatinine was 2.0 with an eGFR of 38.4 ml per minute. Electrolytes of sodium, potassium, ionized calcium, phosphorus, and magnesium were all normal. Total cholesterol of 209, LDL of 140, which is elevated, HDL of 41, and triglyceride of 140. For the diagnosis of the patient during the consult, the patient is diagnosed as a case of chronic kidney disease, stage 3B, secondary to hypertensive nephropathy, hypertension grade 2, controlled, dyslipidemia, and obese 1. For the management of our case, we uh, added that the diet would be strictly patterned with pinggang Pinoy, low salt, low fat, and encouraged to start on a whole food plant-based diet. Therapeutics for our patient, we started the patient also with statins as recommended by the guidelines for CKD, 40 milligrams, atorvastatin, 1 tablet at bedtime, amlodipine, 10 milligram tablet, 1 tablet once a day, preferably in the afternoon to avoid peripheral edema. Non-pharmacologic interventions include the following. Advise the patient to start uh, practicing standard drinks specifically for men, consuming only 1 to 2 bottles of beer. Preferably during this time, we should avoid drinking alcohol, especially on medication. Encourage weight reduction to obtain a ideal body weight of 57 kilograms. Non-pharmacologic intervention. We prescribe the patient with also exercise prescription. Usually the frequency of exercise for 5 days a week, moderate intensity, starting with a minimum heart rate of 105 to 125 beats per minute and totaling of 30 to 45 minutes per session. Some exercises that were advised to the patient include brisk walking, jogging, even cycling. Primary counseling was also done, noted with psychosocial support also rendered as a physician. We encourage the patient to have a family member every time we have a consult so that they would be included in the management of our patient. We also realign the roles of the family. Given that the patient is a financial provider for the family, we need to assess if ever there are other members of the family who could help with the financial needs, especially given that our patient is on medication. Patient also was also advised to practice mindfulness and provide rest from time to time, especially on a hard day work. We also encourage the patient to have enough sleep. Given that the patient only sleeps in a bare minimum, we encourage the patient to sleep 7 to 8 hours with a good quality of sleep and proper sleep hygiene. This includes turning off your cell phones and gadgets and keeping them away from the bed, maintaining a dim light at night, have a shower, eat less at night, and then avoid thinking about work before going to sleep. Also, including the members of the family in the therapeutic ally circle. Follow up was also advised every 3 months, or even with the new onset of symptoms, follow up should be even as early as 1 month. So, diet in renal disease. The Philippine cuisine or the Filipino cuisine is known to be popular all around the world because of its variety, diversity. Ika nga, they noted that is sari-sari, rich in culture, and it's influenced by colonization. From the Spanish colonies, Chinese sailing colonies, as well as the American diet that was still in popular influence as of today. A totaling of 2.3 million Filipinos have CKD each year. To ameliorate chronic kidney disease, we are advising our patients with a whole food plant-based diet. There are a lot of benefits with regards to whole food plant-based diet. It is rich in fiber. It helps reduce lipids in our system, and it has um, decreased proteolytic catabolism, making it less likely to be toxic in the future. So overall, the major goal for whole food plant-based diet would encompass lowering your blood pressure, decrease inflammation, as well as decrease cardiovascular risk and decrease mortality. Major challenges in Filipino cuisine and CKD nutrition has always been a problem ever since we started including diet in the management for renal diseases. There is counterpoint in all our diets. We often pattern our diets with something salt, with something sweety. Native foods also in the Philippines is high on potassium. That's why we have to weigh things on what to give in our patients with chronic kidney disease. Main example with the salt and sweet are in the following photos. Champurrado, pat, patterned together with tuyo. Mangga, manggang hilaw, and alamang, dinuguan at puto. Hyperkalemia is a concern for patients with chronic kidney disease. Consuming plant-based diet is also a risk if there would be increased amounts of nutritious diet that is plant-based that is also high in potassium. We can supplement our patients, however, with what we call potassium binders to ease potassium restriction in CKD patients. Now, in our market in the Philippines, potassium binders are available, one of which in the market is in the generic name of sodium polystyrene sulfonate, which can be given 15 grams 1 to 4 times daily, with the equivalent per weight of 1 mg of potassium per kilogram of resin per day. An article published in the Journals of Renal Nutrition titled Filipino Culinaria, Cuisine and Chronic Kidney Disease by Teresa Carrillo et al. Noted that there are certain tips that would help modify the Philippine cuisine to the CKD nutrition plan. These are the 10 steps that were mentioned in the said journal. Leach vegetables and root crops, particularly potato, yam, and purple yam, to lower the amounts of potassium. Leaching legumes like your munggo can also reduce the amount of potassium, but make sure to take your phosphate binders. Phosphate binders were also mentioned earlier. Low sodium soy sauce and limit the suggest amount of half to original recipe. Let's say, for example, you're cooking your very favorite adobo, use the half amount of soy sauce in cooking your meals. When using green leafy vegetables for soup, add 1/2 raw leaves just before serving for lesser potassium content. Enjoy the natural flavors of fruits without dipping them in the salt or other salty sauces, in particular alamang and manggang hilaw. Incorporate spices like your black pepper, hot pepper, and bay leaves to add more flavor to your meals. Use fresh ingredients rather than using high sodium packed sauce and mix for preparing prepared powdered seasonings or your sinigang mix. Some cold drinks from other countries do not add phosphoric acid or any form of phosphorus. Always read your labels and watch your fluid intake, and you may able to find another type of cola beverage without high phosphorus content. Minimize the use of salt and dried fish. And this process is used, especially here in the country, to preserve meals. As for example, is the use of what we call drying, sun drying, and dipping them in salt. So examples here are your tinapa, tuyo, okay, dried fish like your taing, that is popular especially in the north. Enjoy fresh fish instead. For recipes calling for coconut milk, I suggest substituting with sour cream or 1/2 cup milk. Coconut milk has double the amount of potassium compared to regular milk. Just add coconut extract to obtain that coconut flavor in your meals. Now, as mentioned in that article, what is leaching? Leaching is you soak a content or a vegetable or fruit into water that will help pull out the excess potassium from the vegetable. Now, how do we leach vegetables? First, you have to peel and place the vegetable in cold water so that they won't darken. Slice the vegetable 1/8 thick, 1/8 inch thick rather, and rinse in warm water for a few seconds. Soak in a minimum of 2 hours in warm unsalted water, using 10 times the amount of water to the amount of the vegetable. For example, if you are cooking 1 cup of vegetable, it requires 10 cups of water. This is a way to properly leach out the potassium from the vegetable. If soaking longer, change the water every hour. Rinse under warm water again in a few seconds. Cook the vegetable 5 times the amount of unsalted water to the amount of vegetable. For example, 1 cup of vegetable requires 5 cups of water. Here are a list that was part of that journal of the common fruits in the Philippines. As mentioned, that these fruits are high or rich with potassium, which is alarming for patients with CKD, which is in per se in the diet, we have to limit the potassium stores. So among these, we noted here that would be usually allowed, okay, we have to limit them for 3 servings per day. So 1 serving is equivalent also to 1/2 cup if we are talking about medium or small sized, okay? Watch your portions every time you provide them to your patient. So manzanas, blackberry, the common grapes, actually grapes has a level of potassium that is very much noted to be high, lemon, lime, macopa, mangosteen, passion fruit, peaches, and pears. They are allowed for patients with CKD just as long as you know the limits of their servings. Now, things to avoid for patients with CKD, equivalent to 1 serving is usually 150 milligrams of potassium, are the following: apricot, atis, avocado, banana, breadfruit, honeydew, melon, kiwi, jackfruit, langka, lanzones, mango, and so forth and so on. Here are also a list of vegetables that usually allowed for patients with CKD and to limit and avoid. And these are my reference for this part of the presentation. Thank you and good day.